Hi, my name is Mark Ryan, and I'm the Medical Director of Woodlands Weight Management and Wellness Center in Pensacola, Florida. I'm board certified in internal medicine and obesity medicine, and I take care of patients every day who have medical conditions that cause obesity or have medical conditions caused by obesity. In this video, I'm going to explain the relationship between a very common medical condition, prediabetes, and obesity. If you have ever heard your doctor say, your blood sugar level is just a little bit above normal, but you don't have diabetes, then you likely have prediabetes, blood sugar levels that are higher than normal, but not high enough to be classified as diabetes. You diagnose prediabetes with one of two blood tests. The first and most basic test is a fasting blood glucose level. This is a standard component of any blood chemistry analysis and is very inexpensive. The next test is called the Hemoglobin A1c, which reveals your average blood sugar during the 3 months prior to the test. You do not have to fast for this test, but it is not a standard test, and so you should specifically ask for this to be done. Prediabetes is important to diagnose because it raises awareness of the risk factors that are causing your blood sugar levels to be elevated, and ultimately putting you at risk for the development of type 2 diabetes. I think of a patient that I saw yesterday for an annual physical and diagnosed him with prediabetes. He immediately shook his head and said, I have to stop buying the ice cream sandwiches. Without having pointed out that he had prediabetes and was at very high risk for the development of type 2 diabetes, he would not have given much thought to the effect his diet was having on his health. Diet, along with family history, are the most important risk factors for developing prediabetes. And while you cannot change your family history, try as you might, you can change your diet. So I'm going to explain how diet can cause prediabetes and then lead to obesity. Foods that have a high glycemic index, meaning they cause your blood sugar levels to rise quickly and stay elevated for 2 hours after eating, think donuts, ice cream from our previous example, soda, also cause your body to secrete high levels of insulin. Insulin's job is to quickly store sugar and other fuels into muscle cells for energy. But when there are high levels of glucose, insulin begins to simply store excess sugar in fat cells and even creates more fat cells to aid with storage. Think adipose tissue in your abdomen. Now, in addition to going out on its own and creating more fat stores, insulin also has some disastrous effects on metabolism. It slows down your energy expenditure and increases hunger. Let me repeat that. Insulin causes you to feel fatigued and be less active while at the same time increasing your hunger, leading you to eat more. Terrible combination. You can see how prediabetes signals the start of a very dangerous cycle. Higher blood sugar levels will cause higher insulin levels, leading to higher levels of visceral fat storage that secrete even more insulin, causing you to feel more tired, exercise less, consume more calories, and gain weight. But don't lose hope. Diagnosing prediabetes is the key. As soon as you identify this downward cycle, it's important to stop it. The first step would be taking a close look at medications that can cause prediabetes, like steroids, other psychiatric medications, and the next thing would be formulating a dietary plan with a low glycemic index in conjunction with exercise and medications that can increase your insulin sensitivity, lower insulin levels, and break the cycle of prediabetes. You should have your fasting glucose level and a hemoglobin A1c checked once a year to ensure you're monitoring for this condition. Thank you everyone for watching, and remember that in order to stay healthy, you have to stay active.